Good evening and welcome tonight. We're going to have a great show, but again, we have some great guests, and I would like everybody to get pencil and paper because there's going to be a lot of good information for everybody's family, very serious information. So get a pencil and paper. But tonight, I'd like to dedicate the show to my brother Ronald Cephas, who's sick, and I wish him well. And again, you know, he's the best big brother ever. I mean, he's taking care of me and my other brother, and it's just everything. He's just done so much for me, and I want to thank him and let him know how much I love him and appreciate him. And as a matter of fact, when we was young, we lived in the projects, very poor, and he bought me my first pair of Converse sneaks. Oh. And we was on the basketball team, and everybody had cons, and one guy had a pair of NBA sneaks, and they would tease me. Everybody got cons in the NBA sneaks. So one day my brother came home and put the box out. Oh. So I went to the basketball practice. Now everybody got cons except you. So, you know, he brought me my first Hot Wheels set, and he just taught me how to play ping pong, and he just great. And I just want to wish him well and let him know how much I love him and everybody appreciate him. So everybody keep my brother Ronald Cephas in your prayers. Again, tonight, get a pencil and paper because again, it's going to be a lot of good information. And I'm going to let Dr. Anderson introduce the guests and start the show because she's going to be having a show dealing with health and our community's well-being. As a matter of fact, the state's health and well-being. So I'll turn it over to Dr. Anderson.
So I want to thank you for letting me to co-host tonight.
I appreciate it.
So the community day, this is a very important issue that we have to talk about, and that is opioid overdose. And we have two fantastic people out in the community right now that are championing legislation that have saved lives, people who really care about this issue. And I want to start with introducing first Senator Hall Long, and then we also have Dave Humes from Attack Addiction. So Senator Hall Long, just want to say welcome to the show and tell us a little bit about yourself.
Thank you so much. You know, Dr. Anderson, as you know, I have a couple hats. One is my elected hat in Dover, and that is as a state senator. And the other hat, where you and I have crossed paths, is as a nurse and as a faculty and a professor, doctorally prepared also in nursing. And in both of those capacities, I've been really pleased to help our community. You know, ever since we're little, I think perhaps you were the same way growing up, you knew you wanted to make people's lives better. And that's why I got involved in the community, growing up in Sussex on a farm, taking care of folks, and went on to become that university professor and realized a better impact would be to serve public office. So in 2002, became a member of the State House of Reps, and then moved on to the Delaware Senate, where I currently represent Middletown to Newark, and pleased this year to be also running statewide as Lieutenant Governor candidate.
So tell us what life is like on a farm.
Life is really hard on a farm, particularly if you're with brothers. I know Julius just shared a story about his family and his brothers, but the most important thing though is you learn a lot about hard work and teamwork and being part of a core system of really just knowing you have to really depend upon one another. And you know, you can't control weather, you can't control when things don't go well. But then when you're blessed and the crops come in and the rewards there. And so again, growing up on a farm, you learn a lot about taking care of people and having one another's backs. And that's really served me quite well as a nurse and also as a legislator, you know, knowing how to get along with people. Sometimes, you know, we're like a family. We don't always agree, but when it matters the most and we have to make tough decisions, then you have to get along.
So tell us why you went into nursing and specifically becoming a public health nurse.
Well, you know, public health has a lot of issues. I know you are an expert in sickle cell.
Yes.
Public health, we can get the most accomplished, the greatest good for the greatest number, whether you're looking at cancer, whether you're looking at diabetes, stroke prevention. I realized at a very young age in my nursing career that we could accomplish the most, whether it was infant mortality or whether it was something very serious, of which brings us here tonight, mental health and substance abuse issues. We can truly, with a very small amount of money, make the biggest change and the biggest impact. So public health has been a real interest of mine.
So tell the viewing audience about some of the committees that you currently chair down in Dover.
In the legislature, you know, I'm in the Senate Democrat caucus, so in the majority, I get to chair the Health and Social Services Committee, and that committee obviously deals with health and welfare of our community. The other is the Community and County Affairs Committee, and that addresses county issues in each of our counties, Sussex, Kent, and Newcastle. And it also addresses the municipalities, of which we have, believe it or not, in Delaware, 57. And so it can be something, you know, a community as small as Blades running to as large as our city here in Wilmington. And certainly, you know, we're very fortunate to have a number of different committees. So Insurance and Veterans Committee, Transportation, and one in which I know is very important to the city, particularly with the port. You know, I serve on the Bond Committee. And that's also really important because it's the Capital Budget Committee. So the schools that we have, our highways, the road projects, which in turn translate into jobs. So I'm very happy to serve on that committee as well.
So tell us about your support for the Port of Wilmington. You live in Sussex County, so
Yeah.
why is the port so important to the state?
Well, I grew up in Sussex, and in the House I represented Kent County and Lower Newcastle, and I represent now Middletown to Newark. Really, the health of Wilmington affects the health of our state. The port is a very important, vibrant component. So I've been very pleased, you know, to work to support others also on our legislative panel to put the funds in, whether it was for the crane, whether it was for the update, studies of projects for expansion. We have a great gem in the port. And I feel that, you know, such as the city, we must invest. Just like we invest downstate in agriculture, we must invest in the city, and the port is a real gem to our state.
One thing I want the community to understand, when the port was up for lease to sell, and we fought hard on the Senate side, Senate Bill 3, it won by one vote the first time. Senator Bethany was a serious champion on the Senate side, and again, everybody's talking about the expansion. It wouldn't have been no expansion if y'all didn't do Senate Bill 3. And also, once Senate Bill 3 was passed, and I want to commend the Senate and the House.
Right.
Because the House voted 40 to zip. Charles Potter and his group, JJ, and Valerie, 40 to zip. So it's been a lot of great people. Also, we needed 2 cranes. The bond committee voted for 2 cranes that are coming now. We're ready to go visit the cranes in Germany. So you've done a lot that people, you know, that's just great for the Port of Wilmington. And again, right now, you voted for it. You was one of the ones who voted to invest in the expansion for the study. I think that might have been $200,000. So I'm not sure the amount, but again, she's been there for us many of times. And again, there wouldn't be no expansion if Senate Bill 3 with Senator Marshall championed and got through and passed. So, you know, I don't want people to overlook that. And the port creates 16,000 jobs, a big $300-something million in revenue, and $38 million in taxes. That's inside the gate, and outside the gate is almost the same. So, I mean, we appreciate it.
Oh, you're quite welcome. And, you know, so goes the port, goes healthcare. You know, healthcare is such a huge issue, and that's why I was so excited tonight to be here with David and to talk about some of those really serious issues. And I know with your hat, Dr. Nina Anderson, that goes in tandem. Our economy and the health of our community really is dependent upon the public's health and the economic health, as well as physical and mental health. So it goes so nicely together.
So can you tell the viewing audience about some of your proudest accomplishments down in Dover?
You know, I'll focus some with the health predominantly, but fitting into health are some of the major issues that impact health, and particularly here in the city. Our late Beau Biden, myself, and Representative Keeley and others really worked hard to fight for housing and the foreclosure industry. When the economic crises occurred, to me, that was one of the most proud moments I've had, is to work on getting settlement monies, doing that in tandem with the others, you know, in Dover. In turn, cancer. You know, whether from the Minner administration through the current administration, we really have championed cancer. And we've done a good job. We've eliminated in colorectal the difference in African American and Caucasian. Before, we had a much higher mortality rate. And we've got insurance coverage for anyone who's uninsured in the state. They can get treatment. And I want the viewing audience to realize that. Despite Affordable Care Act or changes that you might have, Delaware has a fantastic program that will cover your care if you have cancer. So I was very pleased to be part of that, you know, legislation. In turn, you know, we worked really hard. I was proud to sponsor, and I was in the House, the Office of Occupational Health, which deals with workplace safety. We spend most of our time in our workplace, so very happy to be part of that. And, you know, I could go on with a list of many others, but I sit here, you know, tonight, not only talking about the past, but looking to the future. And so certainly we've done recently things to our economic health, whether it be looking at preserving our companies locally or investing in minimum wage and expansion of business opportunities in the state. I think that's been critical. Working with health workforce, the workforce where I teach at the University of Delaware, making sure we have a vibrant workforce. And we've done lots of types of different legislation that does expansion. But tonight, what brings us here, I feel most proud, and I certainly know David will be able to talk a little bit about this in a minute, is our legislation with Narcan and our legislation addressing persons with substance abuse and mental health issues.
What is Narcan? Excuse me, I cut you off. Explain that to the viewing audience.
Well, you know, and I think David will probably go into this some with attack addiction and his work. As you know, when somebody is addicted to heroin or an opiate, it keeps you from breathing, suppresses your respiratory rate. Narcan, naloxone, another term, same interchangeable, can reverse that. And we had to work really hard over a couple years to educate both the community, the Department of Health, and family members and law enforcement why we needed that. When somebody responds, whether it's a police officer or a family member, we obviously want to save our loved one. So the administration of Narcan can have the reversal. So the person responds, begins to breathe again. Last year, according to Secretary Landgraf recently, gave a report, we had probably around, 486, almost 500 people, rescued last year and brought back basically, to life who would have died, who had been administered Narcan. So to me, that is truly one of my proudest pieces of legislation that I sponsored, with other members in the General Assembly.
And Mr. Dave Humes, you are very active in attack addiction, and we spoke very earlier today, and you had such a powerful story to share about your son and how you got so involved in trying to help to get this legislation passed. So tell the viewing audience about how you got involved in the organization and your son.
Yeah. What brought me to become an advocate for 911 Good Samaritan law and for naloxone access law in the community was that I lost my son, Greg, to an accidental heroin overdose at 24 years old. As part of his story, drugs and addiction issues can take good people to bad places. And in my son's instance, it took him to prison. He committed some crimes to support his habit. When he completed his prison sentence, his parole was transferred here to Delaware. He lived with me for 3 months, and he had been 17 months free of opiates and heroin, including his prison and whatnot. And he was gradually acclimating himself back in the community, going out and seeing old friends. And unfortunately, sometimes you run into people who weren't really your friends to begin with. And one night he ran into some people who were his running mates. And he thought he could chase that high one more time, scratch that itch. And unfortunately, that decision proved to be fatal. And what happened, he was with those people in a home, and he overdosed. People he was with found him, saw him, they were with him, and they picked him up and they put him into his own car. They drove him to the hospital, and then they just walked away from his car. Had they pushed the panic button on his keychain and let the horn go off, somebody might have come. Had they called 911 to tell him go to the parking lot and look, he very well might be alive. It was an hour before he was discovered. By that time, they rushed him into the hospital. It was too late to save his life. It was also too late for him to have any of his organs donated. He was an organ donor. Subsequently, the investigating detective met with me, and we talked about some of the circumstances of my son's death. And he said to me, he said, if we had a 911 Good Samaritan law or a Narcan law, your son might very well be alive today. And those were the words that stuck with me. And at the time, I didn't know really what either one of those things were. And in the aftermath of my son's death, I decided I wanted to do something, and my vow was that I would somehow save a life in his name. And it didn't matter whether the person whose life saved knew his name, knew my name, and it didn't matter if I knew their name, but the goal was to save a life. And when I thought about it and I looked into it a little bit more, I thought this was the avenue, and that's what kindled my passion for both 911 Good Samaritan law and the naloxone access.
Wait, explain to the community 911 Good Samaritan law, because people who don't know, never heard it. What does it do?
Right.
Can you just explain to the viewing audience?
911 Good Samaritan law, I'm actually trying to change some of the terminology now and actually refer to it as a no-charge 911 Good Samaritan law. And what this means is if anybody is with somebody who has suffered an overdose or appears to be in distress, if they think it may be an overdose, they can call 911 and the police paramedics will come and administer naloxone, save that person's life, and nobody will get arrested, charged, or prosecuted. And what we've found out is really the key is that they don't get arrested to begin with. Because even if they would accidentally arrest somebody and then let them free later on, they miss work, they might get fired. So the people who are with them, are really afraid to make the call in the past. The other thing is we want people to stay around at the scene so that when paramedics or police arrive, they can tell him exactly what the person may have taken, whether he had just alcohol, whether it was heroin, opiates, or whatever. And we have a very strong 911 Good Samaritan law. It's got a very broad definitions, and about the only thing that you won't get immunity for calling 911 for is if you have committed a homicide, rape, kidnapping, or a major felony, such as being a drug dealer with large amounts of drugs there. But otherwise, the police are going to make sure they take your statement, they try to save the life of that person who's overdosed.
That's really good. And was interesting, I guess because you don't see it, and I don't see it, in my daily life, I don't see the impact. And the CDC stated in one of the statistics that there's 47,000 deaths a year from opiate overdose, and 60% of that are from pain drugs, painkillers. So opiates being oxycodone, Percocet, morphine, Dilaudid. And every other day in the state of Delaware, someone dies of an overdose. That is a huge public health issue.
It is a huge public issue, and when you talk about those figures from the CDC of 47,000, they're on only the latest reported figures. They're from 2014. 2013, it was 43,000. So the amount of deaths is still going up, and we have to stop that death rate, in its tracks and move it back. So we're losing a lot of people, and I like to talk about the impact of what 47,000 means. And if you think about the terrorist attack of 9/11, that's 15 times more people that die in a year than died in the terrorist attacks. And to put another number on it for people of my generation, 19 months from today, we will have lost more people from overdose than we lost in the entire Vietnam War.
Wow.
It's a lot of people.
It's twice as much as car crashes.
Wow.
Twice as much as car crashes. And that's why recently our Attorney General, Matt Dinn, and I know David's group was there with us, we sponsored legislation that will actually be signed into law this week where we've established, and I was pleased to sponsor and lead in the Senate, the Overdose Mortality Commission. So much like we have with our child death review, we will now be doing the same for persons from overdose, to be really try to pinpoint patterns, trends, and indicators. So again, much as this is a very sad situation, but from a public health perspective, by forming this commission, hopefully we'll have some more tools in the toolbox, so to say, working through the Attorney General's office and the state legislature.
So tell us about trying to get the Narcan law passed. Did you meet any resistance of people that said, we don't want to do this, we don't want to sign on to this,
Well,
even though they know it's a good thing?
Well, we were very fortunate because the people in Attack Addiction were just a grassroots group, and I like to say we're just really a bunch of dumb moms and dads, and we're learning along the way. And when we attempted to pass the 911 Good Samaritan law, we learned about the legislative process, the committee process, hearings and testifying and whatnot, and just the length of the General Assembly, how long it lasted from January to June each year. So we thought, okay, we'll be prepared this year when we looked into naloxone access. So we actually had some sample bills written up that were specific to Delaware, and Don Keister and his wife Jeannie were the founders of Attack Addiction. They lost their son Tyler on December 23rd, 2012 to an accidental overdose, and as difficult as it is to lose that person that close to Christmas, it was also their daughter's birthday, which makes it that much harder. And within 2 months of that loss, they had started Attack Addiction. So, you know, we were learning, and in the process, we thought, okay, let's look into, you know, getting the naloxone bill introduced. And Don Keister and I were fortunate enough to be asked to serve on the subcommittee, Governor's Advisory Subcommittee for substance abuse and mental health issues. And in the course of that, we were told Senator Hall Long's really interested in this naloxone stuff. And we said, well, we have something for her, and we provided the senator with a draft bill, and she in turn looked it over and looked in, you know, with, I guess, with some of the lawyers within the Senate, and gave us an even better bill to be introduced, you know.
Yep, with Senator Henry and others, and it wasn't an easy process. I think, you know, for the families and the parents, but it's very touching, and I believe at some point, perhaps in this segment, you might have shatterproof the story that Attack Addiction will provide, you know, on the families, but it, you know, very personal, very moving. And the thing about this is it's all socioeconomic strata, it's all races, it's from Brandywine to Blades. And it was an issue every legislator knew in their heart was the right thing to do. It was a matter of the legal process. And I have to say, when we had our first meeting with some police, it was not as easy. However, I think with time that did change. I know Representative Barbieri and I later were able to get the support around that. And, you know, it was an issue at first. But once people recognized that we're going to save lives. And so we now saved 500 family members, loved ones last year. And every other day, we still continue to have this awful experience of a death from an overdose. But it's helped us. Attack Addiction was helpful as well when we were doing prescription monitoring. As you mentioned, this a lot of times starts with a family practice provider or a doctor or a nurse practitioner or PA prescribing, or a dentist, and it slips from an opioid. And we did such a good job, our prescription monitoring system pushed it to the street to heroin, which was cheaper. So we continue to move around. But the bottom line is education, prevention, and I know Attack Addiction's done a great job with our school nurses getting into the school, and I believe you also have a clip on that to share about our school nurses.
Just in working with the legislators, people like myself are fortunate because we can deal with one issue. As far as the legislators go, they have to know so many different issues from the Port of Wilmington and whatnot. So in many instances, some of the legislators weren't aware of naloxone, what it did. And what we like to say is we like to be fearlessly respectful, working with the legislators and trying to educate them. And we educated them to the fact that this is a medication that's been FDA approved since 1971. There's very little potential for harm. It's not a controlled substance. It can't be abused, and it can probably meet the criteria for being sold over the counter too. So when the legislators started to hear about that, some of the pilot programs across the nation, there was, I think, 500 pilot programs and 10,000 people saved in a 10-year period going back to the late 90s and into the early 2000s. So
I have a question. So this has been happening. I mean, this has been dealing with since 1971, saving lives. And I can answer to you, Senator. And now we just got it approved. What do you think? Why do you think it took so long for them to realize that? Because they used it in the hospital, right?
Right.
For the general public that wasn't in the hospital.
I think it's a cycle. I'm certainly not the substance abuse expert. You know, someone from DSAM or the Department of Health and Social Services would need to speak. But a credit needs to be given to the Division of Public Health and Dr. Carol Rattay and others who really recognize this. Cycling through drugs, the patterns have changed. You know, whether you were looking at LSD, then there was the period of cocaine, you know, then we go into prescription drugs, and then now back to street level heroin. Narcan has been used in the emergency room in certain situations, but again, heroin, you know, went into a valley for a while because there was other substances and crack and, you know, of all the others. And now that it's come back in its purest form, and we're now fighting actually the mixture with fentanyl, which is even more potent, and we have legislation currently addressing that, Representative Dukes, myself, and others, and some Sussex. So again, I think the education was there, and it was a matter of public health working with the community, and that's why we're here tonight.
Right.
Is for the community to know if you have a family member, you know, and I know you'll get into this in a little bit, there is training that is available to you that you can have this on hand. You know, certainly our key, my key and others who serve in the General Assembly, we want people to have access to treatment. So again, we don't want them just to have the Narcan to be revived and to go back to their practice. You know, we really want them to go and seek help, to really seek treatment.
That's my I want Ivan. That's one of the things I want to talk about, treatment. But I want Ivan to go to the clips 1 and 2, and then we're gonna come back and talk about treatment. And again, I'm just thankful for you being a champion and getting things done. And I think that you being a state rep and then the state senator
We turn now to
does
our
a
local
lot.
headlines.
Go ahead.
The heroin epidemic. In Delaware, officials accepted a
Can we
donation
hear
of 2,000 cartons of the overdose drug naloxone, and they are coming in the form of auto-injectors administered like an EpiPen. 47 ABC Jabina Fortson joins us live in the studio with more on who will get these. Jabina?
Yes, Emily, I actually have a training injector here that looks just like the ones donated. These will go to high school nurses, first responders, and addiction treatment centers, just to name a few. The market rate for these specific injectors is $490, but the state is getting them for free through a company called Kaleo out of Richmond, Virginia. According to the Delaware Department of Health and Social Services, in 2014, naloxone was administered in overdose situations 1,244 times and revived 668 people.
The more naloxone you can get out there into the community, the more lives you can save. And so we are very focused on getting naloxone into the hands of the right people.
Now, as we mentioned, high school nurses are going to be the recipients of these auto-injectors. And today I talked with one of the nurses in the Indian River School District who explained why this donation is so important for students.
Pull off red safety guard.
This is Laura Booth, the floater nurse for the Indian River School District, and what she's holding is a naloxone auto-injector containing opioid overdose reversing medication. The injectors are normally locked away in medication carts like this one.
We are the first responders in the school, so if the first responders in the community have it, I think we also should as well.
Every single public high school in Delaware has these injectors. Booth says they got them last August, but they were set to expire at the end of February. So the donation the state received for 2,000 more came just in time.
We have something going on in the community, an epidemic, and I think it would be naive to think that it's not going to spill over into other areas.
Like the schools, according to the State Department of Education, no Delaware schools have had to use the injectors yet. But every nurse has standing orders on how to approach a student suffering from an opioid overdose.
It has to be someone who is a known user or has something, on them, paraphernalia.
And of course, physical signs. One of the nurses at Sussex Central High showed us a possible scenario. Note, this is a sample injector.
Come on, take a deep breath. Take a deep breath. Come on.
No response from our hypothetical student, so she gets the auto-injector.
This trainer contains no needle or drug.
For critics who believe having these injectors in school buildings may be a way of telling students it's okay to do drugs because there's now a backup plan, Booth disagrees. She says it's just another tool in the box to save students' lives because if one were to succumb to an overdose,
It would be awful. I mean, the ripple effects would be for years.
Now, Booth is actually scheduled to pick up the new auto-injectors for the Indian River School District tomorrow. Emily?
All right, thank you so much, Jovina, for that report.
Dear Brian.
Dear Greg, from the moment you were born, you were the sweetest kid.
Michael, honey, you brought us such joy and happiness. Thank you for those 29 years.
Like every parent, my dream is for you to be healthy and happy and fully empowered to create the lives you really want.
I coached your Little League games for many years, and I always used to say, with the game on the line, I want the ball hit to Greg.
You were a natural leader, and so many people looked up to you. You were such an amazing person. What parent wouldn't be proud of that?
Just before entering high school, you tried marijuana for the first time with some of your friends.
It has been so difficult to watch you struggle with this devastating disease.
We know our family had a strong tendency for addiction. We all loved you so. You just needed more time to get well and really heal.
You were working hard to stay sober. Unfortunately, one night you made a bad decision, and that turned out to be fatal. You had been lifted into your car, driven to a local hospital, and then left in the parking lot. About an hour later, you were discovered, but it was too late. You had been left too long.
Since the moment when I first heard of your death, I agonized to make sense of it.
I worry that the world is not equipped to deal with the issues of addiction.
Ty, if we had the chance to do things over again, we would not let that stigma of addiction stand in our way.
Brian, losing you has shattered my life. However, at the same time, you have inspired me to make a promise. We are going to equip society to protect our children from developing the disease of addiction to alcohol and other drugs. Addiction needs a national commitment. Addiction needs a national voice.
We know your strength. Recovery is possible.
We are stronger than addiction.
Together, we can end addiction.
We are shatterproof.
Together, we are shatterproof. Please join us. Visit us at shatterproof.org.
And tonight, you know, besides helping Senator Bethany and win Lieutenant Governor, we want to make sure this doesn't happen again and educate the community so this doesn't happen again. I'd like to go to you.
Yeah, you had asked earlier with the medication being around since 1971, why didn't we hear about it more? I think as lay people, there are a lot of medications that we don't hear about. And it was used in hospital settings, in emergency wards by paramedics. In many instances, though, they were administering this by injecting it into a vein, which a lay person couldn't do. And I think what happened, it took a while for people to develop a system of delivery so that a lay person could do this. I know initially in New Jersey when they passed their law and they did the training, they actually gave you a vial of the medication and a syringe. For lay people, that would be very difficult to do in a very tense situation. And so with the intranasal naloxone, that's made it easier for lay people to to administer, and there's little chance of harm that way if they're administering it. So that's part of the reason.
Senator Bethany, anything you want to?
Well, no, I think, you know, the clip I think is very moving because, again, it touches all of us in the community. And tonight, you know, I'm pleased, like I said, to be here because we want to have that message of hope that we can get people into treatment. But if you have a loved one, please know that our laws have changed with both the 911 reporting, the Narcan, you know, naloxone is available. I was pleased, I know, to work with the schools to do the legislation so that our school nurses could have that as another tool in the toolkit. So I think, you know, the message would be tonight that there's so much that we can do. And this is one of the areas that I was very proud to kind of be behind a champion. And there's much more to be done in mental health substance abuse. We have a task force now between the House and the Senate. Senator Blevins, Representative Heffernan, and myself are looking at access to services and mental health and treatment and how we can improve things and prevent it, whether it be substances or other types of mental health, depression, anxiety, because I think most families, unfortunately, have had that experience with someone in their family either having a mental health or a substance abuse issue.
Yes. Again, I know I've seen the work that you've done and that you're doing, and again, the Port of Wilmington, it was a serious fight, and we appreciate what you're doing.
Oh,
and
you're
again,
welcome.
she's still championing the expansion. She's waiting for the study. You know, again, Charles Potter, it was his idea. He pushed it, and he got everybody on board. And I want to give Charles kudos for doing a great job. And I mean, we got a lot of good legislators, on the Senate side and on the House side. And I don't always agree, but the work that they do is awesome. And people need to go down Dover, and you need to see, and you need to be a part of the solution, and watch what they do and support them. And if you have a problem, and you take it to them and support them. But again, y'all just do wonderful, wonderful work. And again, you was a state rep, state senate, professor at University of Delaware, helping out with sickle cell. I believe you were on the board.
Right, with sickle cell. Excellent work of Nina's and other chronic disease issues.
Of chronic diseases. I just want our community to know that she's there. She's doing great work for the city, for the whole state. And she's not a Johnny, just got here doing elections. She's been doing it. She's been on your board for 6 years. She's been on Dr. Anderson's board for 6 years. She's been out there for years. So she's not somebody who's just arrived and tried to rush the things to run. She's been there for years and doing a great job at University of Delaware. And we need good legislators. We need it. We need it. We need it like yesterday. But we also need the community to get behind the good legislators and support them. And again, go down Dover, you know, and see the great job that they do. And if you're not happy, sit down and talk to them. Or if you need something done, because our community needs help. And thinking about our community needs help, I want to give a shout out to Gundy Jacobs, who just got the director of Hicks Anderson Center. And Gundy's a great man. I know Gundy for a long time. I know his father. I mean, I know his whole family. He's like family to me. I can beat him in ping pong and pool, but again, I think he's going to turn West Center City around.
Great.
You know, and I told him anything that we can do and the legislators can do, we need to come down and talk to him. But again, congratulations, Gundy, for being the new director of Hicks Anderson. Also, they want to do an example. Go ahead and explain what you have in your hand, Dr. Anderson.
Mr. Humes, I
Dave.
wanted the community to see what the Invisio looks like. And also, you know, for people that have a loved one who may have a problem with substance abuse or heroin, you can purchase this. Is that correct?
That is.
Okay.
That is. There's a couple different programs that are available here in Delaware. One of them is the result of Senator Hall Long's naloxone access bill. It was geared toward the community. Brandywine Counseling and Community Service has been contracted with the state to conduct trainings, 12 trainings a year, I believe, where they will go out in the community, train them. At the time you're trained, you're issued a card, and you have the opportunity to purchase naloxone at that time, the intranasal naloxone, not the Evzio.
Excuse me, not to cut you off. when they have the training, how can the community know and find out so they can be a part of that?
Okay. There's a couple of different ways they can find out. There's a state site. It's called helpusherede.com, which deals with addiction issues, all sorts of addictions. So that's available, and the training is on there. If you go to Brandywine Counseling and Community Services website, they can tell you what the training schedule is in their community. We have actually expanded on the Senator's bill, and we now have other people who can go out in the community, have been trained and are certified by the state. I happen to be one, so that if a group of people wants to get together, we can go out in the community and train them, even outside of the contractual arrangement the state has with Brandywine. Your doctor can prescribe the medication to you, and so you can pick it up at the pharmacy if a doctor prescribes it. And in many instances, if you're a parent or you have a loved one that's been in recovery for a while, and you fear that they may have relapsed, and you don't want to wait for the next scheduled training, you can actually go into Brandywine, into their drop-in center, which is right across the street here, and get individually trained most mornings, Monday through Friday. So you're able to carry carry the naloxone.
Senator Beth, I want to ask a question, because you've done a lot of great legislation. With the nurses being in high school, training nurses, how difficult was that to see that through?
You know, I think with the nurses, anytime you
training
have,
them, talk about it.
you know, well, the education, you know, the education of nurses is never complicated. You know, it just takes a little time. The schools themselves, when you're dealing with multiple districts, you know, that's where you run into complexity. But the head of the Department of Education's Health Services was very open. Anything that we do, we might do for protection, you know, and for parents. And again, it's not as if we are currently having overdoses every day or anything in the school, but it's a toolkit to be prepared, you know, should we need it. So again, myself and Senator Henry and Senator Blevins and in the House side, Representative Barbieri and others, you know, really said, you know, we need to make this accessible. So together we kind of championed working with Attack Addiction and others, any kind of tool that we can for education with substance abuse. And again, the you know, naloxone is one tool. And again, this is the injectable, which will talk to you, walk you through the administration, or you have the nasal cannula.
This trainer contains no needle or drug.
No, this is okay. Okay.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Right.
So it walks you right through step
Very
to step.
simple.
May be reused for training purposes.
So I just also want to say that you can also inject through your clothes. That's perfectly
Right,
fine
even
with
jeans.
this. With
Even jeans, yeah.
So we're sort of running out of time
Yeah,
here. We
that's
definitely
right.
want to have you back, but just quickly, so what are you doing now? What is your...
Well, you know, this year we're wrapping up a lot of great legislation that will affect the health of the state, which includes economic health, physical health, and mental health, substance abuse. So we'll be coming forward, and hopefully we'll have opportunity to come back with others,
Many.
David and others, to really talk about some of those things that we're accomplishing, you know, in the state and looking forward to. So I was excited to be here tonight as the senator and a candidate for lieutenant governor. Thank you for having me.
No, we still got time. We got 10 minutes.
5.
We still got time. So, again, we can continue talking. They normally they'll let you know when we're getting close. They don't have we still got 10 minutes. So, also again, this is also one more thing I want to say is we're going to have a mayor's discussion. We're going to have all the candidates of mayors come on, and we're going to have questions. You can talk to them, and it's going to be very nice, and it's going to be coming soon. But like I said, again, we still got time. How do people, if they want to volunteer, help out, how do they reach you?
Bethany2016.com, you know, or you know, check out there, and that will give you a resource, a phone number, and a form. And welcome their feedback. And again, just excited to be here tonight as well with Attack Addiction. And I don't know if you have your information that you would like to
we have a
share.
website if they want to contact us, attackaddiction.org. We meet the second Tuesday of every month here in Newcastle County at Caravel Academy. Our meetings are open and transparent. We welcome people. What we want to know is if you're somebody that has a loved one struggling, you're not alone. There's people that will be happy to talk to you about it, and you can join us to take action to make some of these changes.
Also, Ivan, can you put the senator's information up again? Would appreciate it. Again, Senator, the work that you do is awesome. And the port, I mean, you know, naturally, I mean, again, that's 16,000 jobs, we say. And people don't understand this. The first vote was by one. I believe it was by one, and the second vote was 3. That's how tight it was. And again, there wouldn't be no expansion if Senate Bill 3 with Senator Marshall if this didn't pass through the Senate. And so I want everybody to understand this created this created the expansion. We wouldn't have expansion. You'd be talking about it if the great job that you've done and your colleagues done.
And if I might tie it in, we're talking about some addiction issues and the port issue. They're not standalone issues either, because to prevent recidivism and from people coming out and re-entering society, they don't need just jobs. They need places where they can go and get careers, where there's a path forward for a career, not just a one-time minimum wage job. We appreciate people who provide those jobs, but to get a job at the port where they can raise a family and support a family, they're incredibly important.
Yes. Incredibly, and thank you for your service to our community with sickle cell and all that you do with chronic disease.
Yes.
That is something we'll be happy to come back. I know Senator Henry and I are really excited, and Representative Stephanie Bolden on chronic disease. So there's a lot to be done, you know, a lot of work to be accomplished, but it's a good time, and you know, Delaware is moving forward, and I think we've got a lot to be so proud of in our state.
And Dr. Anderson, if you have something you want to close it, then I'll close it up.
I just want to say thank you for coming out today, and Mr. Humes as well.
Dave.
I think you have educated the community, at least raised awareness about this huge issue of opioid
Thank you
overdose.
for having us.
And so we'd like to have you back again
Absolutely,
as well.
anytime.
Great.
And again, we'll be wrapping up, but I wanted to say that the show tonight is dedicated to my brother Ronald Cephas, and get well. And we will be back. Dr. Anderson will have a health show talking about all kind of different illnesses and how to prevent illnesses and everything else. Again, thank you. And make sure September, I believe it's the 13th, come out and vote for Lieutenant Governor Bethany Hall Long. Again, she's been there for years, and she served our community very well. And again, please come out and vote. And you got a great person working with Ricky Williams.
Oh, yes.
Ricky is a champ. You know, he's a champion for you. And Ricky, you're doing a great job. Again, thank everybody. And Charles Potter, definitely you, because dealing with the port, I know you're going to ask me why I didn't say nothing. And we have 2 people running for city council. Reverend Ty, he's running for city council at large, and my man, my ping pong partner, he's going to oh my God.
He must have beaten you last time.
Yeah, he did.
He'll make it up next time.
He did kill me. But again, we'll talk to you in 3 weeks. But thank everybody. Thank you. Good night.
Good
Vote
night.
for Bethany.
Thank you.
For Lieutenant Governor. Lieutenant Governor, September the 13th. Cannon, Bob Cannon, 4th District, Bob Cannon, City Council.